Hello, and an official welcome to this Deakin University Alumni End-of-Year virtual event for the Faculty of Health. Sam Johnson here from the Deakin Alumni Engagement Team. It's great to have you with us. As we gather for this event, physically dispersed and virtually constructed, let us take a moment to reflect on the meaning of place, and in doing so, recognise the various traditional lands on which we do our business this evening. We acknowledge the elders past, present and emerging of all the lands we live and work on and their ancestral spirits with gratitude and respect. This evening, we're looking forward to reflecting on 2020 with you and with the faculty and university representatives who will speak to you shortly. You'll be hearing a faculty update from Executive Dean Professor Rachel Huxley, as well as presentations from some of our wonderful health academics who will share some of the challenges and success stories of 2020 from their areas. Our presenters will then join a panel discussion and you'll be able to submit questions throughout that discussion via the Q&A box on your screen. In a moment, you'll also hear a message from Vice-Chancellor Professor Iain Martin, reflecting on 2020, as well as talking about Deakin's new strategic plan. And I hope that you enjoy that. Thank you.
Good evening. It's always a pleasure to be able to address Deakin's faculty alumni. This evening, I'd like to give you an update on Deakin's major achievements over the year so far and our responses to the incredible challenges we have faced. I also want to spend some time describing our future plans in this very changed world. Over the last few months, we've been drafting Deakin's next 10-year strategy, and I'd like to share with you where we plan to focus our efforts to ensure Deakin's continued success. Deakin's alumni, supporters and friends are absolutely vital to that future success. You help us make a difference in the lives and careers of so many. Firstly, I'd like to reiterate my sincere thanks to all who supported the Student Emergency Assistance Fund, including so many alumni and colleagues. We are inspired and heartened by the many who have made contributions, which have benefited hundreds and hundreds of students during this extraordinarily challenging year. On behalf of the university, personally, and all the students, thank you. The challenges faced by many of our international students have been significant. In the first few weeks of the pandemic, as borders were closing and their casual and part-time jobs were disappearing, we responded quickly to their needs, providing financial support and ensuring they could communicate easily with us so that we could provide additional arrangements for their education and living. We continue to support all our students. They're such an important part of our Deakin community and our local, regional and Victorian communities. We'll be reaching out to alumni and friends in the next few weeks, and we hope you will continue to help our students through this challenging and ultimately formative time in their lives. Without question, this year has been extremely challenging for the sector and for Deakin. We've undergone one of our greatest ever upheavals, and personally, I hope it is the greatest ever upheaval I have to experience. We know that there is still a huge amount of uncertainty and challenges to overcome, but as we leave 2020 and enter 2021, I have an overwhelming sense of optimism about the importance of universities in the recovery of Victoria and Australia. Both the federal and Victorian governments have made further commitments of support to the sector and have publicly recognised the importance of universities in the social and economic recovery of Australia in the months and years ahead. We're working closely with the state and federal governments on this roadmap, and Deakin's contributions to the recovery will be expressed in our new strategy, which I'll talk to later. Our outstanding digital capability has served us so well this year, and the transition to almost a completely online university has been a very successful one. This is absolutely a direct result of the talent and hard work of our academics and professional staff working in partnership with our students. We've seen resilience across all of these communities. Despite all of the challenges, our student enrolment numbers remain strong, higher than at this time last year, and indeed up 4% overall. This has been driven by domestic enrolments, which are up around 8%, buoyed by high demand given the challenging employment market, but also a strong contribution from the government subsidised short courses, mainly focused on postgraduate coursework. However, international student numbers and the stories of our international students are a different story, of course. For this year, we're down 7% overall, but importantly, new commencers are down by 28%, and we expect this to fall further. Despite this, we're working hard with our international networks, particularly in India and Indonesia, on study models that begin courses offshore, then transition to on-campus as the travel restrictions hopefully ease through the later parts of 2021. We're now the largest educator of Australian domestic students in the country, having overtaken Monash in this respect. But, and very importantly, this has not come at the expense of student experience. We retained our #1 rating in Victoria for overall student experience for the 4th year in a row, making 10 years in a row if you include the previous measurement system. Indeed, we are the leading Australian public university in this regard. Deakin cannot function on its own, and this year has seen some new partnerships and endeavours. We're working on the hydrogen economy, and we've established our HyCell advisory board to maximise hydrogen research and development, help to leverage investment and grow collaboration as the demand-driven hydrogen economy continues to play an important part in Australia's future. Internationally, we've established a partnership between Deakin Co and Tata Management Training Centre in India, delivering blended education programs for organisations that will have unique needs post-COVID. We're now casting our ambitions for the next decade in the form of our new strategic plan. The plan will deliver a sharper focus on how we add value to our students and our local, national and international communities. It will be embedded in 2 core activities of education and employability and research and innovation. Our education will focus on course offerings that support students at all stages of their careers. It will integrate career thinking and employability skills into almost all of our programs. We'll focus on high quality short programs that can be built into formal qualifications and make sure that we deliver distinctive blended student experiences using the best of digital and physical campuses across all of our sites. Alongside our education, our research and innovation will see further strengthening of our already strong mutually beneficial partnerships with industry, government and the community. We'll continue to grow our innovation ecosystem with local and international partners, and in doing so, strengthen international engagement and facilitate longer-term local and international collaboration. The academic impact we create from our research is important, but so is the direct benefits that come from it. We'll see greater generation of new products and services, greater influence and improving of social policies, and working on community frameworks. Our strategy has included in it 5 key impact themes. We're going to build our strengths around these themes. These have been chosen because they're both important to society and relate to our strengths in education and research. They're going to help us focus our resources and activities to ensure that we're delivering the greatest positive impact we can. These themes are, firstly, advancing society, culture and the economy. Secondly, building safe and secure communities. Thirdly, creating smarter technologies. Fourthly, enabling a sustainable world. And finally, and by no means least, improving health and well-being. Alongside these themes, we want to see ourselves being a leader in the use of digital technology. Our investment in digital increased greatly with our Live the Future strategic plan in 2011, and this commitment will only be strengthened in our new strategy. We will aim to seamlessly blend online and on-campus activities across all that we do. We'll make sure that our cybersecurity is robust and we protect the privacy of our people and partners. And above all, we'll focus on the ethical use and innovation that genuinely adds value to individuals, students, and the wider community. Across each faculty, we have seen outstanding responses to the pandemic, nowhere more obvious and vital than in the Faculty of Health. For example, through the Geelong Centre for Emerging Infectious Diseases, providing scientific advice to Barwon Health clinicians and helping with local sequencing in its state-of-the-art labs. With Barwon Health delivering telehealth care for the Geelong community, developing a paper strip readout technology for COVID-19 testing and result interpretation that avoids sophisticated reagents and infrastructure, and of course, Professor Catherine Bennett's expertise in the media. We've led a major study into chronic fatigue syndrome in a 5-year project funded by the NHMRC with the lead professor, Ken Walder. We've had 3 researchers named as Victorian Tall Poppies for Science, Dr. Catherine Livingstone, Associate Professor Gary Sachs, and Dr. Anna Ugaldi. They are among 11 academics who are awarded in Victoria. Thank you so much to Executive Dean Professor Rachel Huxley, who's provided wonderful leadership throughout this challenging year and will give you a detailed overview of the year in the faculty.
Thank you very much to Vice-Chancellor Professor Iain Martin for that message. And now I'm very happy to hand over to Executive Dean Professor Rachel Huxley for the faculty update. Over to you, Rachel.
Thanks very much, Sam, and good evening, everyone. Thank you for zooming in and joining us tonight. I'd also like to acknowledge the Indigenous owners of the land upon which we're all meeting to pay my respects to elders past, present, and emerging. It goes without saying that this has been an extraordinary year for Deakin and all universities. But not only has the Faculty of Health coped with the many challenges that COVID-19 has had for us and is continuing to throw at us, but we've excelled across all of the domains of teaching and learning, research, and impact. COVID has thrown a spotlight like never before on the need to have a robust health system and an even more resilient healthcare workforce. This perhaps may explain why right across the faculty, our domestic student numbers have increased, particularly in courses such as nursing, midwifery, psychology, and social work, whilst our postgraduate courses such as the Masters of Public Health have also shown remarkable growth over the past few months. And despite having to rapidly transition all of our courses and assessments to being fully online in a very short space of time, our students remain highly engaged and have enjoyed their learning experience this year. With the onset of the pandemic, our thousands of clinical placements in hospitals and health services across Victoria and the country were in jeopardy of being postponed, delayed, or even cancelled, putting at risk the ability of our students to academically progress. But our close partnerships with our many health partners and our staff's ability to think outside of the box and to work together meant that we're able to ensure that the vast majority of our nurses, midwives, doctors, and allied health professionals of the future are going to graduate on time. And despite having our hands full with managing the rapid transition to online learning, the faculty has expanded its offerings by developing new courses such as a Master of Advanced Clinical Practice in Paramedicine Practitioner, which will have its first intake in 2021, and the very topical Graduate Certificate in Epidemiology Intelligence. In research, we've had some big wins with securing major competitive MRFF, NHMRC, and ARC grants and fellowships. We also have had more than 80 COVID projects on the go, many of which are in partnership with our key health partners, including Barwon Health, Western Health, Eastern Health, Monash Health, and the Western Alliance, some of which will be touched on by our panelists later on this evening. I'd like to take this opportunity to publicly applaud the incredible efforts of our academics and professional staff members who worked tirelessly over the past 12 months to ensure that the Faculty of Health continues to deliver an excellent educational experience for our students and tackle some of the biggest and most pressing clinical and public health problems of our time. Earlier this year, we started developing the next 5-year strategic plan for the faculty. Building on our current strength and thinking what are the greatest challenges ahead of us, we'll be focusing our collective efforts on 3 main areas: preventative health, digitally enhanced and facilitated health, and sustainable health, which we'll hear a little bit more about later on this evening from Rebecca Patrick. Sustainable health speaks to the undeniable role that the climate and the environment has on the health and well-being of every single person, society, and population around the globe. Great partnerships underpin our university, and this year we were delighted to partner with inspiring donors to secure significant philanthropic gifts that will support increased excellence and opportunity for the faculty. This support has been critical in strengthening Deakin's commitment to be a catalyst for positive change to benefit our students, staff, alumni, and the communities that we serve. And I'm proud to share with you a selection of these stories. As a lasting legacy to the late Anthea Wilson's passion for emergency nursing, Anthea's mum and dad, Barb and Doug Wilson, who are here on Zoom tonight with us, generously made a gift of $385,000 to establish a scholarship in Anthea's name at the School of Nursing and Midwifery. The Anthea Jane Wilson Scholarship Endowment is a lasting legacy to support the aspirations of students who embody Anthea's passion for best practice emergency nursing and whom, without the scholarship, might not be in a position to achieve their ambitions. I'm very honoured to have Doug and Barb, I'm exceptionally honoured Doug and Barb have chosen to establish this important scholarship within the school and here at Deakin. The Mark-Ill Foundation made a gift to establish the Mark-Ill Foundation PhD scholarship at the Institute of Physical Activity and Nutrition, otherwise known as IPAN. The director of the Mark-Ill Foundation is a Deakin Health alumnus who shares our vision to support students from non-traditional pathways to make a contribution to human nutrition. And the last story I wanted to share was about the Judy Hill Scholarship, which was established by her daughter Jenny Hill in memory of her mother. Judy was a Deakin alumna and undertook formal studies at Burwood Teachers College, which was later absorbed into Deakin. Jenny's gift of $100,000 will create a scholarship to assist mature women studying teaching or nursing to overcome the barriers they face in reaching higher education. I want to offer my heartfelt thanks for this generosity, and I'm so pleased you could all be here to join us this evening. I'd also like to take this opportunity to thank each and every one of you who has made a contribution to Deakin in some way this year. As we look towards Deakin's next decade, much remains to be done to realise our aspiration to be Australia's most progressive university. And we know we can increase the difference we make on people's lives when we do this in partnership with people who care about our future and that of the communities we work with. If you would like to get in touch to discuss how you can make a positive impact, please do get in touch with myself or with Sam after this seminar. I'm now going to introduce several members of the Faculty of Health to give a tantalising glimpse of the trials and tribulations and successes from conducting research in the post-COVID world. And the first of our speakers tonight is Professor Felice Jacka, who is the Director of the Food and Mood Group. Over to you, Felice.
Thanks so much, Rachel. It's great to be here this evening. I will be quite brief, but I wanted to give you a bit of a sense of what it is that we do at the Food and Mood Centre and where we sit internationally. So we've led a novel field of research called nutritional psychiatry, and this really looks at the influence of diet and nutrition on mental and brain health. Our Food and Mood Centre is unique in the world in its research focus on this topic. And it's important because we know at the moment, this has been the case for quite a while now, poor diet is actually the leading cause of illness and early death around the globe. And at the same time, mental disorders account for the leading global burden of disability. So understanding that the two things are linked is really important. It gives us new opportunities to both prevent and treat mental illness. We've led the first studies across countries, across cultures, across age groups, from right at the start of life through to old age, to show that the quality of our diets matters to our risk for depression, in particular, what we call the common mental disorders, depression and anxiety. We've established diet as a really important factor in brain health. And of course, we conducted the first randomized controlled trial to show that if you take people with clinical depression, moderate to severe clinical depression, and help them to improve their diet, it has a marked impact on their depressive symptoms. We've shown that this is a highly cost-effective approach to treatment of this very debilitating and common condition as well. But of course, what we also know about research is there's an average of 17 years between generating research evidence and getting it into clinical practice and into policy where it can make a difference to the health and well-being of people everywhere. And we think that this isn't good enough, and we've made a lot of advances just even this year during COVID to try and get this new information to the people who can use it and where it's needed. Now, to get new research evidence into clinical practice, we need to train physicians, we need clinical guidelines so that they know what to suggest, and we need to understand how things work in the real world and whether they are effective or cost effective. And in this sense, this year we've started last November, so it's been running for a year, and it's been offered 3 times, a free online course in nutritional psychiatry. It's aimed at the general public, but anybody from health professionals to government people to anyone out in the population can do it. And to date, we've had close to 60,000 students enroll from more than 160 countries around the world, which is really remarkable and testament to how much interest there is in this topic. We've also set up an international task force to develop clinical guidelines for physicians for lifestyle medicine in mental health treatment. And we've secured and will be applying for more funds to do these big effectiveness trials, these real world trials, to figure out what works for whom under what sorts of conditions, and also how. Sam, would you show the next slide, please? So our Food and Mood Centre program, we're only about 3.5 years old, but we're already close to 30 people. And we have a very comprehensive program of research with more than 20 different studies underway. We look at early life factors and the maternal and child microbiome and dietary factors. We look at health behaviours more broadly, so physical activity, sleep, stress, as well as diet. We look at different aspects of mental and brain health, so not just depression and anxiety, but schizophrenia, multiple sclerosis, Alzheimer's disease, PTSD, etc. We, of course, look at a whole host of pathways by which diet might influence mental and brain health. And we're looking in close detail at the sorts of factors that might influence the way our brains age so that we can intervene to improve things for people. So our program really spans from right down, you know, analysis of little molecules, right the way up to big public health interventions and trials, and also, you know, contributing to policy. So it's a very broad program of research. As I said, we're unique in the world. We're internationally recognised for the work that we're doing. And we've managed to do a lot this year, despite the fact that COVID has all kept us all pretty close to home. And I'm really proud of that, because we've had many students who've been affected, but they've been able to change their projects, refocus, and still come towards completion and be successful in what they're doing. So the future is bright for us. We've got a lot of fantastic data that will be published next year, many plans, many new projects that will be able to get into play from February next year. So thanks very much. Thanks for listening. Looking forward to answering questions a bit further down the track.
Thanks very much, Felice, for that very quick, succinct overview of the work. If you do have any questions for Felice, please do type them into the Q&A box, and we'll come to them at the end of the evening. Our next panel member tonight is Professor Craig Olsson, who is the Director of the Centre for Early Emotional Development, otherwise known as SEED. Craig, would you mind joining us, please?
Mute.
Perfect.
All right, thank you. So SEED is really Deacon's research commitment. So the Centre for Social and Early Emotional Development is really SEED's research commitment to promoting the health and wellbeing of children and young people. Our work is based on findings from major longitudinal studies around the world, including our own, which have shown over and over again that mental health outcomes across the full life course are profoundly influenced by experiences in early life, and that addressing the rapidly rising rates of mental disorder we are seeing nationally and globally really requires focused attention on building strong and sustained foundations from the beginning. So from pregnancy to childhood to adolescence, and importantly into young adulthood and parenting the next generation. The primary aims of SEED are to develop systems for monitoring emotional health across the early life course, to advise on the most effective approaches for promoting emotional health, and to engage public health and clinical systems in ways that create long-term sustainable solutions for promoting a secure start to life. Since commencing in 2014, SEED has grown to be a large and vibrant research grouping. We collaborate with research groups across the university as well as nationally and internationally. And we have a particularly close working relationship with the Deakin School of Psychology, given our focus. So perhaps the best way to grasp SEED is to think about everything we do as informing a circle of continuous support and care that aims to promote mental health and prevent mental disorder across the first 3 decades of life. The top of the circle represents all the work we do around promoting good mental health. So this is about understanding how we strengthen the basic building blocks of regulation at each age and stage of development. Building blocks like good physical health, secure relationships, effective coping skills, and healthy values that give rise to globally aware and engaged young people. This year has seen the completion of one of our most ambitious top of the circle projects, which is a system of 7 interconnected sensor surveys capable of taking population level photographs, if you like, of emotional strengths and difficulties and the social environments that structure them from birth through childhood and adolescence and into young adult life. This year has also seen the completion of a much anticipated online living knowledge system, which uses machine learning technologies to search the global literature 24/7 for the latest evidence-based programs for promoting emotional health. The result is a soon to be launched public website that will guide government and communities on the most effective ways of supporting young people. But perhaps the most important achievement this year, I think, has been the first implementation of our population monitoring system in northeastern Victoria, spanning the shires of Baloke and Loddon and Gannawarra. This has been a fantastic learning experience for the team, bringing science to life in communities with the aim of promoting mental health in young populations. But of course, this is only half the story, because we all know life delivers severe blows and at unexpected times, and that these can overwhelm resources that people have. So the bottom of the circle then represents all the work we do around improving clinical services and treating mental health problems. So this is about understanding the basic therapeutic building blocks for re-regulating children and young people who have become emotionally unwell and often socially disconnected due to life, chance and adversity. This year in particular, we have faced some of the greatest threats to our mental health on record, from unprecedented fires and huge loss of life at the beginning of the year to an unprecedented global pandemic. So really now more than ever, we need the best evidence-based treatments in the hands of the best clinicians to prevent what many consider a tsunami of mental health problems coming our way. In response to this, one of our most innovative clinical achievements this year, in collaboration with Deakin's Artificial Intelligence Institute, has been an online avatar designed to help young people understand the precursors of self-harm and suicide. We're also working on a similar smartphone-based system for eating disorders and other interventions supporting school engagement, sleep, and those with chronic medical conditions. We also know that alcohol and other drug use has escalated to higher levels than seen before. This year, we've really accelerated our research on treatment of drug addiction in young people using mindfulness-based approaches that are being trialled in collaboration with Odyssey House. Most importantly, though, we know that life adversities don't fall equally, and that some young people are simply more vulnerable than others. This year, we were particularly pleased to launch one of our most ambitious national trials yet, one that will use transcranial magnetic stimulation technologies to treat social cognitive problems in children with autism. Our plans going forward are to further invest in precision public health research by trialling our community-based monitoring system in increasingly more complex and vulnerable communities. We plan to set up new research programs in the area of trauma, loss and grief, and make new investments in the very critical area of planetary health as it relates to mental health. We feel as a team very privileged to be doing the work we do in one of the most foundational stages of the entire life course, and one that sets the stage really for all else that comes. So thank you, and I'll hand back.
Thanks very much, Craig. Critically important work that the SEED group do. I don't think anybody would dispute the trials and challenges that COVID in particular this year has thrown in terms of challenging everyone's mental health and those of our young people and our children in particular. We're going to change tack a little bit. I'm going to ask Anna Peeters, Professor Anna Peeters, who's Director of the Institute for Health Transformation, just to give us her take on what's been happening. Thanks, Anna.
Thank you very much, Rachel. It's a real pleasure to be here. So thank you and welcome to everybody who's online at the moment. I wanted just to start with a snapshot of the Institute for Health Transformation. So it's a bit of a map of who we are and why we do what we do. And so the things that I would draw your attention to are that we're over 200 researchers across Deakin who have a joint purpose around addressing 21st century's most compelling and complex health challenges through excellence in collaborative research that is focused on transforming how we design and deliver prevention and care. And so just to highlight some of those complex health system challenges which we were set up to address, and which, as everyone has touched on, have been called into full flight this year with COVID. They include things like adapting to the changing profile of Australians' health needs, capitalising on the rapid digitalisation of health, supporting better integration of our complex and fragmented service systems, driving systemic improvements in the safety and quality of health service delivery, reducing persistent health inequality, and improving the sustainability of our health systems. And to address these health challenges, we integrate a range of different disciplines, so quite a multidisciplinary approach, and a range of different expertise. And that you can see in that little schematic in the middle of the slide, ranges from things like determinants of health, through obesity prevention, quality and patient safety, all the way through to digital health and health economics. So I'd like to move on now to really the context of 2020 and what that's meant for the Institute for Health Transformation. And I guess, as you all know, the strategic context has been quite striking this year. And for us across the Institute and with our many partners who range from community organisations through to government partners, through to health services and healthcare organisations and industry such as health insurers, it really has been a seismic shift this year. So the strategic context ranges all the way from COVID-19, which has had an impact on a number of the systems that we work with and through to try and transform design and delivery of prevention and care. So we've seen upheaval to our health systems, upheaval to our food systems, our health services, our aged care sector, our disability services, our social services, and higher education itself. And as I'm sure you're aware, upheaval is both a challenge and an opportunity. And I think for us, it's been really interesting to look at how you best respond to the challenges and grasp the opportunities. And I'll touch on some of those. We've had ongoing royal commissions into mental health, aged care and disability. But despite all that, and I think that's really one of the nice resonating themes from tonight, is our academic researchers and their partners, all the way from students through to seasoned academics, have really been unbelievable this year. And I also want to call out my thanks and appreciation to them and our professional staff who have meant that we've been able to have, at the same time as we've been adaptable and agile, we've had strong ongoing partnerships and grant success. So our response at the Institute has been in many areas, but in 4 key ones. So one has been a large focus on engagement and connectivity across our membership and with our partners. And in fact, that's led to a lot of initiatives that I think we're going to continue beyond COVID. We've seen a strengthening of our engagement and connectivity. We've had to really pivot, is the word of the moment, to enable rapid grant applications, funding, project development, and delivery of outcomes. So that's again something that we want to hold on to as we move forward. We've developed lots of expert opinion pieces to try and contribute in a much more rapid way to the knowledge exchange that's been required to respond critically to the COVID pandemic and all the system upheaval that's come from that. And as I'll show you in a moment, we've also supported the university to develop a COVID-19 research webpage again, so we can enhance that knowledge exchange. So for us, the highlights have included an increased public and political focus on epidemiology, public health and health systems, and that's been really enabling for the sort of research we do. As I'll show you in a minute, our early and mid-career researchers have really come to the fore. They have shown strong leadership and strong innovation, and I think a lot of them will have identified partnership opportunities that otherwise may not have come along. As I alluded to before, we've continued with traditional funding sources. So we've had new Heart Foundation and NHMRC fellows announced this year, and congratulations to them, and strong National Health and Medical Research Council and Australian Research Council success. And it's meant that we've been able to provide expert roles in statewide research programs in virtual health, healthcare workforce wellbeing and prevention. So just to finish, I just want to finish on the next slide. This is just an illustration. If you want some more, just go to our website, which is illustrated up the top there, and you can see how we have been responding to the pandemic. There's a Meet Professor Catherine Bennett, which I'm sure all of you have seen her on her daily news bulletins. And you can also see our project and the perspectives from our early and mid-career researchers, which I find really exciting. And I think if you read some of those, you'll see that our future is in very good hands. So thank you very much.
Thanks very much, Anna. I'd just like to remind you, if you do have any questions for our panel members, just please type them into the Q&A box. Our fourth speaker tonight is Professor Jo Salmon, who's the Director for the Institute for Physical Activity and Nutrition. Jo, over to you, please.
Thanks very much, Rachel, and great to be speaking to everyone tonight. This is our new website that we were excited to launch recently. The Institute for Physical Activity and Nutrition is all about how we can promote active living and good nutrition across the population. We have 4 research domains that focus on basic science through to primary prevention, trying to prevent the onset of disease, and also secondary prevention, working with people who have a chronic illness and helping them to try and stay healthy and out of hospital. And then more recently, looking ahead, we're planning to do more research in sustainability, as well as using digital approaches, and I'll talk about that in a moment. We have had some successes this year, which is pleasing in terms of our funding, lots of grant applications, and as other presenters and Anna just referred to, it's been very challenging this year with COVID. There's been a halt on quite a number of studies. Our labs were shut for quite a period of time. Field data collection had to stop. So, you know, a lot of our researchers, and we've got over 80 in our institute, you know, focused on data that they have in hand. They did lots of grant writing as well, and have still managed to be successful. And so, you know, a massive thank you to all of our staff for their huge efforts. And as well as our PhD students, we've managed to have 14 PhD completions this year as well. Thanks, Sam. On to the next slide. So I thought it'd be interesting just to talk about one study that was conducted in a quick response to COVID and the lockdown, because as everyone, I don't know if everyone on the call is in Melbourne or Victoria, but you know, we've had a particularly sustained and protracted challenges in terms of our freedoms, and exercise and being active was one of the few that we managed to retain. So two of our fantastic early career researchers, Dr. Lauren Arundel and Dr. Kate Parker, in March when the lockdown happened, I think it was the last week or couple of weeks, but we were allowed to sort of still have meetings in the office, and they planned out to do a national survey to see, well, what's the impact of COVID-19 on physical activity, on people's sedentary behaviour, their screen time, and their well-being as well. So thanks, Sam. Go to the next one. So the Our Life at Home study is looked at a number of those factors, and I just thought it might be interesting to share. And this is, they established a cohort study, a national cohort across the lifespan, and I thought it would be interesting just to show you the data from that. Some of the preliminary data, and the August data is very recent that we've added into this. And as you can see, walking on your own, perhaps not surprisingly for adults and adolescents, was the #1 most frequent behaviour, physical activity behaviour that they reported. Walking with family was also high, and I don't know about everyone else, but I certainly noticed myself a lot more families walking in my neighbourhood than I've ever seen before, and it'd be great if that was actually continued, although you know, well, it seems to be sort of fairly steady state in terms of the responses from most of the adults and adolescents. Children, it was sort of a bit up and down. Running increased, and in this survey we did ask participants whether or not you know, wearing a mask changed the activity choices, and I do wonder if particularly for those adolescents, they felt then maybe, you know, if they didn't have to wear a mask, then they might, you know, if they ran, they might be doing a bit more running, so they didn't have to put on that mask. And cycling for leisure was maybe, you know, a little bit variable. Thanks, Sam. If you want to go to the next slide. And just thought it'd be interesting to pull out some of the Victorian data, because we did have that more extended period of lockdown than the rest of the country. And a lot of people really lent on digital platforms for their physical activity. 40% of adults reported they used a digital platform, and just under a third of adolescents and a quarter of children. Most of those digital platforms were, particularly for children, facilitated online classes, and so sports clubs and you know, many other, you know, dance studios and things offered their lessons online to children, so they were still able to be active at home, which was wonderful. And this is going to be interesting moving forward, how much, and you know, with sport during that lockdown period not being able to engage, you know, a lot of coaches and training was also conducted online. How much of these strategies are going to continue? There were obviously lots more questions that we asked in this survey, but just in the brief snapshot I've got time tonight, I thought it'd be useful to present some of these interesting data. And now, of course, the next stage is to look at, as we come through lockdown and out the other side, what happens with people's sport and physical activity engagement. Thanks, Sam. So looking ahead for us, the future challenges and due to a lot of those changes, a bit like the food and mood and others, we go from preconception, infancy, right through to older adulthood. And digital platforms are just increasingly a part of everyday life and something that helps us to reach all members, a lot of the members, not all members, but a lot of the members of the population, from whether it's online web platforms or apps, wearable devices. And this is just a little snapshot of some of the projects that are funded by NHMRC and the MRFF that we've got going, and very exciting ones that are being scaled up and implemented, so that, you know, we can reach hopefully large chunks of the population from infancy, in the primary and secondary school space, through to adults and older adults, through telehealth delivery and other platforms. So this is really the future for us, and will be focus of a lot more work moving forward. Thank you.
Thanks very much, Jo. And I should just say that if anybody does have any sort of questions and wants to find out more, then all of our speakers have terrific websites, which I encourage you to have a click on. Our final panel member tonight is Dr. Rebecca Patrick from the School of Health and Social Development. And Rebecca's been working with myself and Trish Livingston to start thinking about a sustainable network of in health across the faculty. So Rebecca, over to you, please.
Thanks, Rachel. Hi, everyone. My rapid fire talk is looking into the faculty's crystal ball. So that's 2021 and beyond. Now and into the future, the Faculty of Health is building and expanding its sustainable health assets. Why? What are they? And how will we get there? Let's just start with the why. It's now broadly accepted that we're entering a new geological epoch, which is known as the Anthropocene, whereby humans are having a colossal negative impact on the natural environment and our ecosystems. These natural systems are the same ones we depend on for fresh air, water and food, and a stable, safe climate in which we can live. The World Health Organization believes that climate change poses the greatest threat to public health in the 21st century. By 2030, we'll be seeing at least 250,000 additional climate attributable deaths every year. And that's from just 4 climate sensitive diseases, including heat stress, which Australians are particularly vulnerable to. That'll also cost our health sector upward of US dollars 2 to 4 billion a year. Ironically, the healthcare system, which carries the burden or is the front line to the increased admissions that we may anticipate, is also responsible for approximately 7% of our national greenhouse gas emissions. But the good news is action on climate change has human health co-benefits, and more on that in a moment. Also on the slide, you can see how Deakin is already responding directly to these challenges. We have already committed to carbon neutrality by 2025 and carbon negativity, which means sinking carbon, by 2030. As Professor Martin pointed out, 2 of our major components of our strategic plan are sustainability and health, and they're university-wide priority impact themes. In the Faculty of Health, we view these as inextricably linked mandates, and we already have considerable capacity within our faculty, hosting research and teaching activities, including a couple of those featured at the bottom of the slide. Thanks, Sam. On this slide, I've mapped our faculty's existing as well as some of our emerging capabilities for sustainable health against the United Nations Sustainable Development Goals. The Sustainable Development Goals, for those that you haven't read the fine print, each of the sub-targets have climate and environmental measures embedded. So a recent audit of research, teaching and partnerships within our faculty demonstrates we have capabilities across these 6 areas that you can see in the slide. For example, in Goal 2, we have existing capabilities in sustainable, healthy and food systems. And by way of example, Professor Mark Lawrence from IPAN is a public health nutritionist and food policy researcher. He's leading a program of work on sustainable diets and food systems. Goal 3 is about protecting health and preventing disease arising from environmental hazards. Our own Professor Rachel Huxley is an air pollution researcher, and Catherine Bennett is in this space by way of being an infectious disease expert. Goal 4, we have quality education, and this is a cross-cutting theme for us. We already have undergraduate majors in health and sustainability, as well as environmental health within our Bachelor of Health Sciences. And we're looking to develop master's courses, particularly around our strengths in epidemiology, economics, and environment. Goal 11 is about our health promotion strength. My research group, the Health Nature Sustainability Research Group, has been doing research on the benefits of human-nature connection for more than a decade. Goal 12 is an emerging area and includes our health economics team within the Institute for Health Transformation. So that's responsible consumption and production. So we're starting to develop a research and teaching story about efficient and environmentally sustainable healthcare systems. Finally, goal 13, which is around climate action. We have many pockets of research on climate change, including research on at-risk communities and cross-cutting with some of the other presenters, young people and mental health. Thanks. Next slide. So what's ahead? Our plan is to establish a virtual network for sustainable health, including on our Deakin website. This will help us to profile the expertise that we have in the Faculty of Health and tell our story of the research, teaching and partnerships we have at this nexus, or we're developing at this nexus. The virtual network will also enable a more systematic and integrated offering of the undergraduate and postgraduate training we have in sustainability bubbling up right across our schools. The network will also help us to facilitate large-scale interdisciplinary programs of research, which are really required for these complex global sustainability and health challenges, such as the SDGs on the other page. Ultimately, we anticipate the collaborative efforts will enable us to apply for major bids and develop partnerships with philanthropic and local and global partners. We're just starting out on this journey. We welcome any support and contribution, whether that's time, connections, resources, ideas, even a new name. There may be some naming rights in there for someone. So if you see something in this for yourself, your communities or the organisations that you belong to, please email me and join us in this new campaign towards sustainable health. Thanks, Rachel.
Terrific. Thank you very much, Rebecca. We are running a little bit over time, but we do have a few minutes for a few questions. And the first one I want to ask is directed at Felice. Yesterday, the mental health report was released, and it was terrific to see the work of the Food and Mood Group being widely quoted. I think it's the first time in any type of mental health report that lifestyle and food and nutrition were given center stage. How did you manage to get the work that the research findings into policy so quickly, given the inordinate length of time that it normally takes to get from research into practice? How did you do it?
Yeah, it's a good question. And obviously I have a fairly high media profile, and that's quite strategic, because when you upskill everyone else in the wider population on a particular topic, then they start to ask the questions and they start to demand change themselves. So that's one avenue. Myself and Associate Professor Adrian O'Neill, who's our Deputy Director, we also work with the Mitchell Institute, who do policy, and we contributed a lot to a policy report that was published this year. I made a submission to the Productivity Commission, so they've obviously looked at that and paid attention to that. But of course, we also had, towards the end of last year, the Lancet Psychiatry Commission report on the physical health of people with mental disorders that really highlighted this 20-year mortality gap between, people with serious mental disorders and the general population. They die much sooner, and that's because largely of cardiometabolic illness and these chronic diseases. So the work that we do looks at the shared pathways that influence both mental and physical health, so things like your immune system and your metabolic system, etc., but also those shared behaviours, diet, exercise, sleep, smoking cessation, those types of things. So I think everything's converging to make it very clear that we can't continue to just treat mental health and physical health as two separate things in silos. We have to bring them together, and this is where our work is really making a major contribution.
I would agree. And for those of you who are looking for a Christmas gift idea, there's a terrific book out called There's a Zoo in My Poo with Felice, written by Felice Jacka. I highly recommend it. It's a very informative and hilarious read. So the next question is for Craig. Craig, for parents, what are some of the best publicly available resources you can recommend to help children and adolescents navigate these difficult times?
Yeah, that's a really important question, and one that I noticed. We had a letter from Scott Morrison. I think we all had a letter from Scott Morrison in our postbox recently, laying out those various services and resources that we could access. And I thought it was a very important move. And so the best place to find this information is on the federal government website, and you can access that fairly easily. I think the big thing that we've noticed in our data, though, just pointing this out, is that many families and many young people have done very well. They've pivoted, they've adapted, they've had the resources behind them to kind of make the most of this very difficult year. Where the real problem seems to be coming through is the groups that had the pre-existing kind of conditions in the first place, the vulnerabilities, the kids that had the previous experiences of mental health issues, substance use issues, and so forth. So it's like a wicked part of this pandemic that it kind of takes the vulnerable and makes them more vulnerable. And so I think the clinical response and the clinical services that are available to families is pretty important at this point in time. But certainly the best place to go is the place that the federal team have put together for this. And I don't actually have the web address with me at the moment, but it should be fairly easy to find.
Okay, thanks, Craig. And there's another question, Felice, around the resources around what are the publicly available resources around people wanting to find out more about nutritional psychiatry. And I think the course that maybe you just want to mention the
free online course. If you Google Food and Mood Deakin Future Learn, you'll find the course. I think that it's just about to be run again over summer, so people can join that, and that's been hugely popular. I also published a book last year called Brain Changer that sort of sets out the science, but in an accessible way, so people can look at that for more info. And then, of course, the Food and Mood Centre website, we've got a lot of info on that design for the general population. Important to note that we'll be developing training in nutritional psychiatry for health professional groups next year. So dietitians and general practitioners and psychiatrists working with the peak bodies to develop these accredited training courses. And then we hope to develop a micro-credential course to be offered through Deakin on nutritional psychiatry.
You heard it here first. Thank you, Felice. Now, here's one for all of you. In your opinion, do you think the good behaviours that people have adopted during the COVID lockdowns in the past few months are outweighed or not by the bad behaviours that people may have acquired? So the good behaviours, increased physical activity, spending more time with walking and with friends and family, versus the drinking, excess eating perhaps. So just your thoughts, please, everyone. Where do you see it tipping? Which direction?
Well, I don't know if that's possible to answer that, but I think certainly the extra time that people have maybe got back in their days from losing the commute to work, I would love to see if that continues on, where there's maybe a hybrid model of working, that people continue to take that time to be active rather than sitting in a car. We also have in IPAN a survey that's happening at the moment in the nutrition space, so I can't answer that, but I have heard anecdotally that there's been lots more, well, not even anecdotally, I think there is fact that a lot more alcohol is being sold. So yes, I don't think that's ideal to continue.
Anybody? I think you make a good point, Jo, and this is why I'm so interested in the connection between epidemiology, the environment, and economics. Less time in our cars, less traffic, less pollution. That's got to be a plus for our health and our environment's health. So, look, we are out of time. Oh, so Anna, go on. I'll give the last.
I was going to add that I think that that's one of the strengths of the kind of academic community, government, health sector partnerships that we all have, is actually what you need to do is identify which of those things are beneficial and work out how to maintain them, and which ones you then don't maintain. And it's the same in, health system change more generally, food system change more generally. So what I hope is that in our partnerships, we've actually learned the processes to better respond to the changes that are beneficial for us as a society.
Well said. We're at time. I'd like to thank you all for participating. I'd like to thank our student audience for zooming in and joining us tonight. So it just remains for me to wish you, despite it being November, and I do have an aversion to doing this, but I would like to wish you and your families a very safe and enjoyable Christmas. And I look forward to seeing you, as many of you as possible, in the new year. Sam, over to you.
Thank you very much, Rachel, and thanks to all our panelists and all our attendees for joining us. I'd just like to reiterate what Rachel said. All the best to you as we move forward into 2021. Any feedback, please do send it through to deaconalumni@deakin.edu.au, and please do keep your details up to date with us so that we can keep you informed about events and initiatives happening in the new year. Thank you very much. Have a good evening, and we'll see you next time. Bye.